Good afternoon, and thank you all for being here today. Our community is undoubtedly concerned about the coronavirus, or COVID-19, and any potential effect it may have on our community of Gregg County. That's why I'm here today, to address any fears and facts and talk about what each of us can do to stay healthy and keep our community healthy as well. We want to have the most current information available to the public, and to that end, late yesterday afternoon, Dr. Brown reported a COVID-19 case had been confirmed by the Center for Disease Control. Please know the individual in question did not contract the virus within our community and has been in self-isolation for the past 2 weeks. Dr. Brown and Dr. Anderson will elaborate more on this shortly. We have been and will remain vigilant. Staying healthy depends on each of us, but also the readiness of our local health community. I have been very impressed by the collaborative efforts of our local health providers and would like to start by thanking them for joining me here today. All of us truly value the importance of the collaboration, which is one of the things that sets Gregg County apart. Thank you, Dr. Lewis Brown, Gregg County Health Department, Dr. Brett Burnett, Travis Session, Chief Operating Officer, and Keith Ellison, Chief Nursing Officer, Oliver Lummi Regional Medical Center, and Dr. Mark Anderson, Chief Medical Officer from Christus Good Shepherd, where the patient had been treated. I would like to commend them for their abundance of caution and adherence to the CDC guidelines. All of us know that as media coverage of this situation increases, so can the level of fear among the public. So my message is very simple. We are guided by the Center for Disease Control and by our medical professionals who currently convene daily, sometimes more, to ensure that not only are our emergency preparedness plans updated, but that we are following them in every case. Many people have been involved in this process to ensure that we are doing the best for our patients, our healthcare workers, first responders, and the community we serve. Everyone can do something to help, from staying home when you are sick to washing your hands. So I would like to invite Dr. Lewis Brown and Dr. Anderson and/or Dr. Brett Burnett to talk about how we are working together to follow the CDC guidelines and how you can do the same to stay safe. Dr. Brown?
Okay. As you already know, we do have our first case. We had been meeting with most of the...
Sir, would you mind stepping up to these microphones, please?
Okay.
That's fine. Let's go.
Yeah.
Thank you.
So as you already know, we have our first case. We had been meeting before all this because of the CDC guidelines and stuff. We did not prepare if this happened. We prepared when it happened because we felt that that was the best way to do it. We've had the fire department, the police department, the sheriff's department, the hospitals involved, the ERs involved, and everybody is on board. You know, we've already faced this before. I've been around for several of these issues. Some of them are new people. I mean, we have fought the meningitis outbreak in the 1990s. We've had the Ebola scare, the SARS scare, the hurricanes. We all did that. And these group of people that we work with, some of them are new, but they've all been phenomenal to work with. And so I'd say we've been tried and true through this stuff and been able to combat things when we've needed to. This is just another thing to be combating. Just to go through a few things that they asked me to do, and just signs and symptoms of COVID-19, which is a little difficult because it really mimics influenza. You know, fever, cough, shortness of breath, sore throat, usually upper respiratory symptoms, muscle aches, pains, and that's what makes it so difficult to sometimes sort people out from influenza from this. We are on the downswing of the influenza outbreak. There was kind of a peak and we're on the downside. This is obviously on kind of the upside for us. You know, influenza starts usually in the very late fall. This started over in China in late December, and then now it's crossed the oceans and everything like that. It does show how small of a world we really have, and also how mobile the world is. And it is kind of interesting to think that here in Gregg County, we already have our first case above other people. But that also shows how mobile people are. The biggest thing right now is identifying these patients. We have had persons of interest that most of them were not really persons of interest. They were more scared. We ruled them out. This one case, we were able to keep them isolated, and that's going to be the main thing about all this is, you know, isolation of people, and actually isolation of people to, I hate to say, not congregate, which we're doing right now, but to try to minimize how much contact we have until this outbreak hopefully starts decreasing. You know, one of the biggest key things is the 6-foot rule, and the 6-foot rule is if you can stay away from people in 6 feet, if they're coughing and stuff, you minimize your cough droplet and thing. The more you touch people and objects and things like that, the more you're going to catch it. The biggest issue is trying to do cleaning, and just decrease the amount of viral load, and that works for influenza, it works for this, almost any virus. The things that we still need to be vigilant about is making sure people still are immunized on influenza, even though it's going down. We're still in the possibility of getting that. Also, people above 50 years of age, if they haven't gotten pneumonia vaccination, that would be a good idea, because some of these illnesses, influenza, this can certainly cause a pneumonia, and that would make you be less susceptible to having a secondary infection. The schools have already been very involved in this, the universities in doing restriction, because we are in spring break right now here in the state of Texas, and the schools have already put certain limitations on what their students can go and where. And you know, the schools are also in the process of deep cleaning the school to make sure everything's okay when they come back. If you think you have COVID-19, we're trying to tell people, don't just jump up and go to the emergency room. What you do need to do is probably call the emergency rooms or call your local provider, your PCP, and discuss things. And if they think you need to be seen, there are ways to get you in there to minimize contact. And again, that goes back to what I just said, try to keep people away from people. Just people sitting in the emergency room and jamming it up, and they may or may not have it. And some of the screening we can do over the phone, and even if in the office, as I always say, I have a side door in my office, so I can always get people in. We used to do that in a lot of these childhood illnesses. We would have sick kids come into the side door so nobody else would get sick. I do think long range for this, we're going to have to eventually go from this travel restriction and sorting out who has traveled and then getting infected. It's going to be eventually local contacts. This is a travel contact, so that's good, but now it's here in the community. But like I said, I think we have him or the patient contained very nicely, so minimize any problems. Certainly everyone understands traveling overseas is not necessarily a great idea. I mean, the big countries that they're screening are China, Iran, Italy, and South Korea. But it is in almost every country now. It's almost it's everywhere. And those are the big places, but you just need to be careful. Way we're dealing with these patients, or patient, because that's all we have, is if they test positive, we will have to make sure that they're negative before we really say they're totally released into the population. We're trying to isolate, or you can call quarantine at home. That's probably safer than trying to quarantine them in the hospital, because there's too many people in the hospital that be contacted. The biggest issue we have to worry about, though, is some of these people can get into a very severe adult distress syndrome with their lungs, where they really suddenly deteriorate. But if we can keep people away from everybody, I think that that's the best idea. And that's about all I have.
At this time, I'd like to invite the Christus personnel, either Todd or Dr. Anderson. Would you like to come forward?
Good afternoon. I'm Dr. Mark Anderson. I'm the Chief Medical Officer for Christus Good Shepherd. I want to say that Christus Good Shepherd and all of Christus really values our coordinated efforts with the Public Health Department, and it's due to that coordination of efforts with the Public Health Department that led us to be able to test this patient that came through our facility for COVID-19, which came back positive yesterday. Just like many other infectious diseases, our emergency department and hospital staff are trained on how to deal with them, isolate patients, use protective measures to prevent transmission of disease, both to our healthcare workers and to other patients. And so because of that, our personnel, both in our emergency department location and in the hospital, used all CDC recommended guidelines in personal protective equipment and isolation precautions in order to prevent not only them potentially coming in contact with the disease, but potentially transmitting it as well. Our emergency department staff and hospital associates are all very well trained. Again, this is something we've dealt with for many years, going back to when we were worried about Ebola, which never spread in the community, influenza, which we deal with every year, to common cough and colds, and in tuberculosis. So this disease is no different in how we isolate and contain it and provide personal protective equipment for our associates. In our hospitals, we provide isolation spaces that are away from other patients, not within the normal hospital traffic, and our associates are again trained to prevent spread of the disease outside the patient's room and into the hospital. So our hospital is a safe place to care for patients no matter what condition they have, and it continues to be to this day, regardless of the fact we had one of these patients now diagnosed with COVID-19 come through our system. I'd like to really acknowledge our emergency department staff and our hospital associates, all engaged in diagnosing this case. It is really their diligence and persistence in coming after this diagnosis and being aware of it from not only public media, but also from the training they're receiving that led us to be able to make this diagnosis. The mission of Christus Health is to extend the healing ministry of Jesus Christ. And our associates and our physicians do that every day. They embody that mission in our community. And I think that's very important that they're there to provide community support and training and education, as well as treatment of patients. I'd like to mention that the same advice I give my family, I would offer to the public, which is you want to prevent spread of infectious disease by simple things, the same thing we would do for influenza. Wash your hands or use an alcohol-based hand cleaner frequently, particularly when you're out in public places and touching doorknobs or shopping carts and things like that. If you're ill, stay at home. Don't send your children to school when they're ill. Don't go to work when you're ill and potentially risk the transmission of disease to your fellow coworkers. If you are ill with a fever and cough and respiratory symptoms, be sure to contact your primary care physician, where they can give you advice about what the next stage is in potentially getting treatment, whether it's to come to the office. If you're really acutely ill, come to the emergency department. But being aware that most cases, even with COVID-19, do well and can be managed at home, the way this patient has been. Although this patient came through our system, he was discharged home, and he's doing well and recovering at home at this time. The health of everyone in the Longview community is our highest priority at Christus Good Shepherd. You know, our physicians, nurses, associates are experts, and they're involved in making sure we can do the best for our patients and our community moving forward, and appreciate your support. Thank you, Judge.
At this time, we are open for questions.
Judge Shell, what do we know about the patient in the county who's tested positive?
I would divert that to either Christus or to Dr. Brown. Dr. Brown, have to stay there. Why don't we just do this?
Well, I am not sure what more I can tell you because there are HIPAA violations that are involved. You know, it's a travel exposure. And as far as I know, that's the only place. I don't know what you want me to say without doing HIPAA.
Where was the travel?
They asked not to divulge that.
Okay.
Do you have an age range?
Was it domestic or international?
They asked not to divulge that.
Oh, okay.
We heard there were multiple possibles, but you only have one confirmed. Were there other people that were checked out and cleared, or was there only one case?
He is the only one that I know of that we actually did the antibody, not the antibody, but the COVID test. The other people we were able to rule out, and they were not, you know, they were not patients that really had it. They were people who were scared because they had had travel experience and stuff, and then they either had influenza or they just had a cold. So,
Can you give us a specific location of what city this person lives in?
he's in Gregg County. I mean, I think that's all that's appropriate. He's in Gregg County.
Curious, at what point did the patient come in to Good Shepherd and was then tested for COVID-19?
Well, we weren't able to get the test sent off until about Friday? Thursday, yeah, Thursday. We got the test sent off. It takes at least 72 hours right now the way it goes, and so Monday was the earliest we were going to get results. We're hoping, and it will happen, that when these test kits are available, the testing will be a much quicker, timely fashion, because right now everything is having to go to Atlanta, Georgia at the CDC. They had an issue with the first set of test kits, and now we've got the second set, and the turnaround will be most likely within a day, so we can move quicker. The decision, you know, was he could be isolated anywhere, and so the house was fine. He was watched to make sure he didn't deteriorate.
How long is the patient in the hospital?
And just really just, I think, several days.
There's one thing I want to add for information that just came out this morning is the University of Texas Medical Center will be a testing site now. And they're prepared to start testing now. Dr. Calhoun is your contact there.
Yes.
Do we have a county or area protocol on, if we do have an infected person at one of our businesses or employment, is there a protocol that will be followed that the county would manage, or is that left up to the individual companies, or have we had that in place that we know who to trace back exposure, or who we might isolate?
Well, the answer of that is if he's sick, he needs to be home. You know, I think that everyone has been so used to influenza, and employers have wanted people to show up. In the last few years with influenza, employers are much understanding that if you come to work sick, you're going to get the rest of your coworkers sick, and then that's going to make a very big strain on that company. If they have this, they will have to be at home or somewhere isolated until we can get them tested. And then number two, Eventually tested again to make sure like 2 tests are negative, and then we say you're okay. You know, again, it's trying to keep people away from each other, and you know the hand washing and everything. You know, he had alluded to that. I tell people, I said, quit touching your face. You know, it's, you know, if you get something on your hands, is do not bring it up to your face and stuff like that. How you get things, and that's been a very big stay. People forget to add that part of it. But then again, make sure that you keep your hands clean if at all possible.
You suggested going to a primary care physician rather than overlooking the emergency rooms. Obviously, a lot of people want to go to things after hours when PCPs may not be open. Appointments may be available time may be stretched out. What is your suggestion there?
The other part of that was, I said, before you go to the emergency room, you need to call them and say, talk to them, and they have people that can at least field some of that. And part of the screening that we have to do on these patients is you do some epidemiology to see if they really are a risk. And that's how that goes with some of these patients who thought they had something. And with the epidemiology, we go, well, you're not at risk. You know, you didn't go anywhere, you didn't travel anywhere, you haven't been sick, you know, except now you probably have the common cold. You know, and that's going back right now. We're we are in the allergy season now, so people are going to have the sniffles and coughing and sneezing. Again, we still have the influenza going. That makes it a little bit more difficult, but I think the main thing is trying to contact people at those facilities if you're going to go, and that way they go, well, let's do this. Yes?
Is there any determination of how long this COVID-19 virus is going to be around? Is there any information coming down from maybe Washington or any other medical sources of how long this virus is going to be around?
The answer is basically no, because this is a novel virus. It's a brand new mutated form of a common virus. Coronavirus is a virus out there. And this is a more virulent strain because it just came out. It's hard to prognosticate that it's going to only be here 6 months or whatever. We're all hoping that, come summer, that number one, people get dispersed and are not so congregated in closed buildings, because in the summer you don't want to be inside buildings. The increased temperature, the sun, it's like influenza basically dies out during the summer. It may still be circulating, but it's not as virulent. We're hoping that's what happens with this, but that is more of a hope from us, but it's somewhat of an educated hope from how other viruses have dealt with.
In East Texas, I know like around this time of year, going into the summer, there's times like where different communities and cities, they have different festivals and stuff going on. Is there any recommendation when there's big things going on with cities and communities, or whether to cancel them, whether to keep them going, or precautions that can be taken?
Well, that is a big thing that is going on. Personal deal, I had to go to Dallas for a medical meeting this weekend. Some of the medical meetings that are scheduled in the future are already being canceled because people know that, number one, people don't want to come to them. And the question is, I think they've already done that in Austin. The Southwest by Southwest deal got canceled. I think you're going to see a lot of big events. Either people don't show up or they're just going to cancel them. Again, part of the issue is going to end up being how long we're having issues with it. So if by May 1st or June 1st we're hardly having any outbreak, it will be much more likely that it's safe to be going to these things. But time will tell. Again, we're dealing with something new, and so it's kind of hard to say this is what it's going to do. Now, having said that, we have with the SARS and the MERS, are still coronaviruses, so we've had experience with that. And those did drop down during the summer. They came back the next year. We kind of expect this might do this, but we'll have to see.
What date last week did the patient come to Good Shepherd, and how fast were they isolated?
That I don't.
If you'd like, I could answer that. So, thank you, Dr. Brown. So the patient presented to our emergency department last Tuesday, and we followed CDC recommendations and public health recommendations on the levels of isolation. The patient spent 48 hours in our system before being discharged home in good condition. During that time, we were able to run some diagnostic tests, which led us to believe that there may be an alternative diagnosis. In cooperation with Dr. Brown, the health department, that's led us to believe could be some testing was required for COVID-19. And again, with the result coming back yesterday. We were following the CDC guidelines specifically for all isolation precautions during that time. You know, if you look at the CDC guidelines, when it's not a clear indication of travel, which I'll say this is a travel case, it was not clear at the time, it was the diagnosis of an unknown cause of pneumonia that resulted in the CDC guideline activation for testing.
And so to be clear, they came to the emergency room at the main hospital, correct?
He came to one of our emergency departments. It wasn't the main one. So. Dr. Brown?
Yes, sir.
If a person becomes ill and is tested and he becomes found to be positive and he's isolated, would it be feasible to think that an investigation need to be done on that particular person as to where he's been and who he's been in contact with to see if they might also be infected?
It's feasible, and that is what is being done, because to get to that point, we've had to have some epidemiology where the people are talking to the patient about travel experience or experience with somebody who was sick. Since nobody had this in Longview, there would be no, at this point in time, there would be no experiences that they go, well, I was exposed to somebody that he knew of or they know of. So to have got to that point to be isolated, we already know what's going on. Or we've isolated them and we're still trying to get the testing done. Again, when these test kits come available and much closer, so it only goes to Austin, or thank goodness it looks like we're going to be able to do it in Tyler. We're going to have a quicker turnaround and be able to quick answers. We are on a defensive position right now. There's no way you can be active about it. We do not have a vaccination. We don't have an antiviral that works on this. We have to practice good management of trying to prevent spread, and preventing spread of illnesses is really good hygiene, and you cannot say that enough, but great hygiene. People just forget to wash their hands, and so we're in a defensive posture trying to prevent spread.
What's the period of incubation from exposure to development?
It is considered between 2 days and 14 days. And that 14-day window to me is a little bit of an issue because you may not know you're sick for 14 days. 1 day, 2 day, you're only around a few people, but you can be around a whole lot of people for 14 days, and so that is not good. Most of these other viruses and things like that get you very fast. When you get around influenza, you get sick within a day or two.
How long will this patient be isolated?
You're doing basically 2-week windows. Like I said, once he tests negative, and I forgot what day it is, that it's the end of his first 2 weeks, we'll test him again, and then we'll see where he's at. But basically, I guess the answer to that is some of those cruise ship issues where the people were on a cruise ship, they took them to San Antonio, and then they're watching them for 2 weeks, but then they're having to still, if everybody seems to be well, they still send them out of that area, and then they still have to be watched for 2 weeks because theoretically, on the cruise ship, you know, this is tragic on this cruise ship. You know, you don't get sick, but you've been on that cruise ship and then they finally release you from that port or wherever. Well, you might have got it on the last day and now you're incubating. So it's basically 2-week windows to think about.
When it comes to their condition, how's the patient doing right now?
As he said, he's great. He's improving daily. And he's, like I said, at his house, and he's really, I think, getting bored.
Do we know if the patient had pre-existing conditions?
That I don't know. You know, you mentioned that. The key, I see a lot of people who are in my category that the key people to worry about are over 60 years of age. The children seem to be not having the complications of it. They can spread it, but the older patient over 60 is a key victim of this. If you have immunocompromised, so if you are a cancer patient, if you're on some of these chemotherapy, there's immunomodulators for certain diseases that decrease your immune system, you are more prone to catching this. So those people need to be very careful. I mentioned the other day, I said, if you've got someone in a nursing home, you almost need to ignore them, because you don't need to, everyone doesn't need to come into these nursing homes who potentially could have gotten sick, and then now they've got a susceptible population. I don't really mean that, ignore them, but they need to be, people need to be absolutely sure you're well before you go to these nursing homes, because these are all immunocompromised people. And that's basically what you saw in Washington State. You know, the nursing home patient population got sick, and somebody had to go into that home and was sick.
Is there any effort, I guess, to reach people, particularly those who are elderly, who, considering the fact that all media is here, has been talking about this for a while, may not know all the facts about this disease, to try to get some education towards them, since they are most susceptible? Well,
I get that's the one reason why we're doing this, to make sure people are more aware of it. It's hard to believe that nobody doesn't know about it by this time, but I'm sure there are.
Jimmy, let me answer that. We're working on putting it up on the Gregg County website. It'll have additional information and updating on a weekly basis, and probably some common sense pointers you've heard here today regarding hygiene and so forth. So that'll be continually be updated, so they can be going to that.
You know, of course, some of the elderly do not have computers or computer literate.
I'm talking about, for instance, my grandmother was not going to go on a computer and doesn't understand everything that's coming from television.
Well, you know, the best thing I can say about, if you can get on the cdc.gov website, it has just got unbelievable amount of information. It's as most up-to-date information, most current. As AJ, which is my assistant, he's my number one man, you know, he said, do not do Mr. Google or Mrs. Google. You know, if you're going to get on the computer, get onto the proper website, and the cdc.gov has a very large area on there.
As far as those who were in contact with the patient between coming back from domestic travel to the point of being tested, are those people being tested also?
Those people are being observed, and a lot of them are now in isolation.
Do you have a count?
No, I do not have a count on that. Didn't ask. You know, put it in a little bit proper perspective. I mean, you know, if you go on the CDC website, I mean, you know, 20,000 flu deaths this year in the United States. You know, right now, there's 761 in the United States that have positive COVID. There are 27 deaths. 8 of are resolved. In other words, they got watched and everything. 8 are okay. and worldwide, it's 116,000 worldwide that have gotten COVID. The death rate is 4,000 worldwide. You know, this is serious, okay, but, you know, influenza, again, people forget about that, and we're all focused on this. We need to be focused on it all, and, you know, I am not saying we don't need to ignore this at all. I'm just saying, you know, there's some more illnesses out there that have actually done more damage than this has. But we don't know, and that's what bothers people. The unknown is terrifying to people, and I understand that. And that is a thing that we're trying to make sure that with everything that gets disseminated, that people at least are informed. I wish I could tell you we got great things to do right now other than keep clean and keep people away. That doesn't sound like much, but it actually does a lot. Even in influenza, if you practice those guidelines with influenza, people are much better off. Okay. Worldwide, 64,000 people have recovered. So, you know, again, the death rate and everything is very low, actually. But, and those are people we know of. Of course, who knows what's going on in every country.
We can sit here probably all day and take questions, but we're going to probably try and wrap this up. Is there any last question that someone has in their mind that they wanted to ask?
I could sit there all day. The person being isolated, are any medical professionals going to their home and caring for them, or are they just caring for themselves?
I can help with that. So the answer, he's caring for himself, but we're making contact with him on a daily basis to ensure he continues to improve.
With the virus like this, is the best thing for it to just let it run its course? There's no medication that can be taken, just let it run its course?
Correct. I mean, there is no treatment for this, so you hopefully get over this. Even before influenza had the antivirals, people would run their course generally. There was always complications. So yes, it has to run its course. If anyone is under observation, they are having to contact us daily and report to us. And so there may not be another healthcare person right in that house, but we are talking to them daily and actually several times a day to make sure everything is well.
Yeah, just one more. You said that 68,000 have gotten through and got over the illness?
Worldwide.
Worldwide. Can they be reinfected?
I don't think we know that. That was postulated a few days ago. People say, does this give you lifetime immunity? I don't know. We don't know. I would suspect it probably does, because that's how we got over measles in the old days and stuff, is you got ill, and if recovered, then you have lifetime immunity.
Okay, thank you. One last thing I'd like to do, these people that are standing behind here, and there's many people in this room, Mayor Gladewater's here, good to have you as well. We've got a number of people from this community all over from Gregg County here, and you've got first responders that make up a lot of people sitting in this room. We have the Northeast Texas Public Health District, which is we're working very closely with. It's doing that investigative work that someone was asking about. I think the last thought I'd like to leave you with is we all have to take care of each other. We all have to be communicating with each other. We all have to be very open and transparent about this issue. And that's why we're having this press conference today. And we'll continue to update the media. We'll continue to update the public. And we thank you all for being here. We're adjourned.